Yeah. So, okay. So, Mr. Francis Green is an 18-year-old man admitted to the ward 6 days ago with a diagnosis of first episode psychosis. He was started on haloperidol 5 milligrams thrice a day 3 days ago. He became agitated on the ward, wanting to leave. He was given 10 milligrams of haloperidol intramuscularly on 2 occasions as part of rapid tranquilization. Blood taken on admission was normal. Nursing staffs have noticed that he's become unwell. Vital signs are given as below. Temperature is 41 degrees centigrade, pulse rate is 104, blood pressure is 140 by 90, respiratory rate is 22 per minute. Blood investigations sent again revealed his white cell count to be 14,000, CK levels to be 1,024, AST to be 44, and ALT to be 82. Other blood parameters are normal, urine analysis is normal. On examination, there was also some muscle stiffness. The task is to talk to the father of this patient to explain the cause of this presentation and devise a management plan. Address his concerns, ideas, and expectations. Do not take a history.
Okay. So let me know when both of you are ready.
Yeah, ready when you are.
Yeah, I'm also ready.
Okay. So enter the station, do your task.
Hello, Mr. Green. I'm Dr. Panwala, one of the doctor looking after your son, Mr. Francis.
Hello, doctor. Thank you so much for speaking with me. I'm very worried.
I can see that you are quite concerned about your son, Mr. Francis, and I'm here to address all your concerns. So, would you mind sharing with me more about your worries?
My son was admitted 3 days ago. They mentioned he had first episode psychosis, but the nursing staff mentioned that he's become physically unwell. So, is he having an allergic reaction to his medications? I don't know what's happening.
Yes, Mr. Green, your son, Mr. Francis, is not having allergic reaction, but it is kind of what we think he is having a condition known as a neuroleptic malignant syndrome. It is
Okay,
actually a very, very rare side effect of antipsychotic medication,
okay,
and it is very
okay.
unpredictable.
Okay. Does it show up on a blood test or?
Yes. So what we did, like when his medication was started, so nursing staff noticed that he is, kind of feverish, and he was very physically, he was confused and weak. And I also did his physical examination, and I
Mhm.
found that his muscles, that muscles are very, kind of tight and stiff.
Okay. Mhm.
So we did like there are one of the one of the blood test is this creatine kinase that we sent,
Okay. Okay.
and we have the report.
Okay.
Is it okay if I go ahead and explain you a bit more about that?
Of course, doctor. Yes, please.
So, so apart from the things that I told you that he had fever and he was confused, he was sweating a lot. In order to confirm this diagnosis, we also send blood report this creatine kinase, which is basically a breakdown product of muscle.
Okay.
So, which is found to be high in Ms. Francis' case.
Okay.
So, which confirmed that he is having this neuroleptic malignant syndrome.
Okay. Is it dangerous? How dangerous is this syndrome?
Yes, so it can be dangerous in some cases because it can lead to strain on kidney and heart, which can lead to
Okay.
change in blood pressure. So in a way, it can be dangerous, and in some instances, it can also lead to death.
Okay. Okay. That's very scary. So how do we treat it? What do you do now?
Yeah, yes, Mr. Green, it sounds very scary, but let me reassure you that it can lead to death in 10 to 15% cases, which are out of hospital and which are not
Okay.
detected on time. But luckily,
Okay.
in Francis' case, he was in hospital. We have picked it
Okay.
up early, and we have,
Mm-hmm.
first of all, we have stopped the medication that is responsible for this.
Okay.
And we have also, referred him to the expert of, team from different specialty. So, and we have
Okay.
shifted him to medical ICU side.
Okay. So what
So
happens to
those,
him now?
yes, so those doctors, like, they have started him on, he was very hot and feverish. So medications, paracetamol have started, to cool down his temperature.
Okay.
And
Okay.
also IV drip and IV drip have been started. And we are
Okay.
also encouraging him to drink more water orally.
Okay.
And the main medication has been stopped.
Okay. Um, can can he get this condition again, doctor, after it is treated?
It can, as I told you, it is very rare, very rare, like
Mm-hmm.
since it is one in 10,000 maybe. So again, chances of it happening again is again very, very rare. But let me reassure you that we
Okay.
have, picked it up early, and we will document this side effect into his medical record,
Okay.
so
Mm-hmm.
that, in future prescription, everyone will be more alert, and this
Okay.
NMS will be in forefront of our mind.
Okay. And I mean, how are you going to treat his psychosis in the future?
Yes, so since his physical condition is not good at this time, so he's in ICU. So we think that maybe for 1 to 2 weeks he will be there, and by that time we will keep, watch on his mental state. And once
Mm.
he's better, we will start him on other group of medicine which have, different
Okay.
structure than haloperidol
Okay.
that he was on,
Mm-hmm.
and we are hopeful that
Okay.
he will get better.
Okay. Thank you, doctor.
Mr. Green, thank you so much. But do you have any other question for me?
Um, no, doctor. I mean, I was just really worried about my son, and I just wanted to know, what we could do going forward and if he was going to be okay.
Yes, I can see that you are very much worried about Francis, and we too are worried, and we are actually hopeful that he is in a, safe hand currently. And we usually, physical health is as much important as his mental health. So once he is physically
Right.
stable,
Right.
we will, we will start him on another group of medication for his mental health.
Okay.
1 minute.
Okay. And they will not cause the syndrome that you just mentioned?
Mr. Green, let me tell you, like, any medication can cause this kind of side effect, any antipsychotic.
Okay. Okay.
It has very small risk of causing this kind of side effect, but we will
Right.
be more careful. We will
Mm-hmm.
start any other antipsychotic with low dose, and we will very
Okay.
gradually increase the dose, and
Okay.
we will keep, his physical health and mental health in forefront of our mind.
Okay. Okay. Great. Thank you, doctor.
And I'll also provide you, leaflet about neuroleptic malignant
Mm-hmm.
syndrome.
Okay. That'd be great. That sounds
If
great.
you have, yeah. And if you have any question, you can always come back to us.
Great.
Thank you so
Great.
much,
Thank you
Mr.
so
Green, for
much.
talking.
Okay. So this ran very smoothly, but let me tell you, NMS doesn't run so smoothly in the main exam. The person will be very, very anxious, and it's understood, isn't it? You mean the person's son is having NMS, so the most of the time this station can come as a communication station.
Angry
It
mother.
should be,
Mm.
yeah, yeah,
Mm.
or it can be like I got serotonin syndrome as actually very, very calm actor. So that was not they are not checking my communication, they were checking my knowledge. Okay.
Okay.
So it depends. Don't be stuck that NMS or serotonin can come as a management station. I mean, sorry, as a communication station. It can come as a somebody who's very calm, like you got in this station. So I won't be surprised if that happens. But most of the time, when the situation is such that the person is, you don't know what you're talking about. So most of the time, they do give the actor at least who's a bit more. Exactly, like don't think that a person can be slightly angry so that they'll not check your communication. Like most of the time, communication is checked when it's very, very difficult to take control of the station. Okay, so person can still be slightly angry and it's not a communication station. Okay, but it's very, very rare to find an actor who's very calm in this station. Now, coming to your station, see, what I will tell you is try to make it more natural. Okay, it's almost like it looks okay. Forgive me if I'm saying something which you're not wanting to hear, but it almost looks like you have rehearsed your phrases and you're saying that. Okay, like I can see that you are very worried. Okay, the person has already told you she's worried. Yeah, so you don't need to say that. Best would be, okay, it's understandable, okay, to be worried in your position. That's what I call communication. If already told you I'm very worried about my son, and then you are again saying I can see you are worried, does that make sense to you? You're not communicating with me, you are just rehearsing what you have learned to speak in the station. Yeah. So if the person has said, doctor, I'm really worried. Plus, this station comes as a management station. Most of the times, they'll give you 3 minutes to prepare. The reason I'm not giving you that much time here because you already know the stations prior, isn't it? So if you are given that much time, so they give you lots of information, and whenever they give you information, it's for you to use it, right? So you can check, okay? You can say that it's very much understandable, okay, to be in your position and be worried. May I check what you know about your son so far? Or, and then, whatever the person will say, then it's your job to actually summarize what you know, that he was admitted. The actor will not tell you that person had first episode psychosis. It's very rare. They'll say, my son was admitted, he was taking cannabis. All I know is he came here, and now I know that he's in ICU. What happened? Okay, so it's your job to summarize it, say that, okay, this is he was admitted to us with first episode psychosis. We started him on some oral tablets. Okay, and he was still at risk, he was trying to leave the ward. Then we had to give him injection, 10 milligram of an antipsychotic, and then we had to repeat that. Okay, after a while, the nurses noticed that he was a bit stiff. Don't say tight, he was a bit stiff. He was running high temperature. He was a bit confused. We ran some blood tests. We did some urine investigation, and the results have come. And what he's actually presenting with is neuroleptic malignant syndrome. Okay, you can either say it like this, or you can say, get the information from the person and then build up upon that. Say that, just come straight up to the point, because at times they'll say, what the hell has happened to my son? Okay, they won't let you say anything, they won't let you summarize anything. So say based on the investigation and the treatment, I mean, sorry, not the treatment, based on the investigation, you know now here also be careful. At times CPK levels are awaited, at times they have been, you already received. Okay, so sometimes they say suspected, sometimes they say it's confirmed. Whatever is given in your station, you can say that he's got this very rare and unpredictable side effect of the antipsychotic medication, which is known as, he's presenting with neuroleptic malignant syndrome. And then check what the person knows. More obviously, the person will not know. So then you can say that, he's presenting with stiffness, he's got high temperature, he's a bit confused. All this happened. I mean, remember, even though NMS is something which is not going to happen because of anything else, right? Unlike serotonin syndrome, where there can be multiple causes. Here, it's almost definite that it has happened because of haloperidol, right? But when you say that it is very rare and unpredictable side effect of the medication. Unfortunately, this has happened in your son's case. Okay, and yeah, and also be careful about the CPK levels. Have they already arrived, or are they awaited? Even if they are awaited, you say you already started the treatment because the diagnosis is heading towards that way. You have to justify whatever you are saying. Okay. The reason people fail CASC is because they go with a answer which is there in their mind. So they are so occupied with saying that phrase, they forget to listen to what the actor is saying. Okay. Now, when they sometimes they can ask you, how rare is that? Now you said something like 1 in 10,000. Now, have you read this figure?
Yes, I have seen Maudsley or something.
Don't say any figure if you don't know. Okay. What I know is the frequency is less than 1%. Still check it. Okay. When I saw that was different, maybe it has changed. So whenever you say figures like this, be very, very careful. Okay. That you've read it. Okay, if you read it somewhere, some
Yes, I have.
authentic place, either Royal College leaflet or whatever. Okay, but be very careful, because if you give wrong information, that's like giving wrong information. Okay, you get really bad score, right? Now, So this station actually goes with most likely containing the person, okay, letting the person speak, lots of empathy, telling what NMS is, collectively why you are saying it is NMS. The blood pressure is rising. He is appearing a bit stiff. Don't talk any medical jargon. Respiration is a bit on the higher side. He's running temperature, okay, and he's stiff. The blood test and the urine test have come this. Based on that, and we think he's got neuroleptic malignant syndrome, which is a very rare and unpredictable side effect of the antipsychotic which we've used for him. Okay, now the question comes, why did he use that? Okay, so as I said, because it is very rare and unpredictable, doesn't happen with everyone. Plus, he was putting himself and others at risk. He was trying to leave the ward. Okay, this was required in order to help him settle down. We tried other avenues before. We had to give him this medication. Again, they can ask you, why did you use this particular medication? Here you can talk about the guidelines. The guidelines, they talk about the use of haloperidol. It is used in many patients, and the chances of anyone developing NMS is less than 1 in 100. We can never predict if this is going to happen. But let me tell you something, that he's in safe hands. He's in the hospital. We have shifted him to the medical ICU, where there is a team of doctors looking after him. Okay, and now talk about what they are doing. Not IV fluids. So first of all, we've flagged this in his notes. We've stopped the medication, flagged this there. Okay, then we're giving him paracetamol to bring down his temperature, also cooling blankets. Okay, we are giving him fluids through the veins to flush out the medication as soon as possible, and also to take care of his fluid levels. Okay, then obviously there's no other medication to take care of your NMS. Okay, the nurses and the team of doctors are monitoring his vitals, which includes, say, everything. Okay, recording of temperature, recording of his breathing, recording of the heart rate. Everything is being monitored very closely in a supervised environment. Okay, he is in safe hands. Okay, now the question comes, what can he die? So say that what are the now the chances of death is 10 to 15%. Okay, I say most of the times the chances of people dying are when they are in the community, undetected and untreated. In your son's case, he's in the hospital, he's in safe hands, and we've already started treatment. Okay, so I'm pretty hopeful he should recover. What are the chances he'll recover? How many days he'll be here? Most of the time it takes up to 2 weeks to settle down. Okay, however, I cannot exactly comment on the number of days he'll be remaining to stay in the hospital. What we can assure you, we are on your side. We are looking after your son, and there is a team of professionals who's looking after your son. Now, question about mental state. At the moment, his physical health is a priority. Once he's stable and out of risk, okay, we'll have to start him on another antipsychotic from a different class at a very low dose and gradually build that up. Again, that would depend on what the mental state is at that time. He may not require further antipsychotic at that moment. He may not, it's not that, okay, he's out of NMS and you are going to start antipsychotic. He might not require that. If he's got first episode psychosis, he's got resolution of symptoms, you can wait. Why do you want to start antipsychotic if he's not psychotic at that time? Okay, so it will depend on our assessment at that time whether he needs any antipsychotic. Plus, if he requires antipsychotic, it will not be haloperidol, it will be from a different group of medication. Okay, he'll be okay. So these are the questions where you should be asking.
Can I ask a question, please?
Yeah, sure.
So, in reality, this patient this parent would be very agitated, and then he comes in and then he just throws the question.
Yeah.
This is a side effect, isn't it? Are we
Yeah.
supposed to acknowledge it?
Yeah,
Right.
absolutely.
Yeah. Okay.
Yeah, absolutely. That's what I'm saying. You say that, yes, it is, because see, it's not like serotonin syndrome that the person may have taken overdose, may have taken an NSAIDs, and the other group of medication, right? The
Yeah.
NMS is almost certain that this has happened from haloperidol, isn't it? So
Yeah.
you have to say that unfortunately it is a rare and any very unpredictable side effect of the medication which we gave him. But at the time it was required to keep him safe. We did
Okay.
not inject him the medication straight away. We first gave the oral dose. When it didn't work, then we repeated the oral dose, and only after that we gave the injection. Okay,
Yeah.
it is very unfortunate that it happened with your son, but the chances of it happening is less than 1 in 100. It's very rare and unpredictable. There was no way we could have known that this would have happened to him.
Sure.
Any other question?
Thank you.
Okay, next
Thank
station.
you.
I'm sorry, can I have one query, please?
Yeah.
What if, in this case, the patient is, sorry, the role player is really angry and gets a bit out of control and says, I'm planning to sue you, and you have put my son in trouble. I'm planning to sue you, and I'll sue the entire hospital. In case such a scenario comes up, how do we express it?
Doesn't matter. Most of them will say that. Say that I'll help you. I'll guide you through the patient advisory liaison system. Okay,
Okay.
on how to
That's
make the complaints.
okay.
Okay,
Okay. So
it is their right.
we would help them and let them know that we are there to guide them
Yeah,
in that.
yeah, absolutely. Many patients will make complaint. You can't help that. Let them
Yeah.
make complaint. Yeah, you just have to say what you have done. You're not
Yeah.
going to stop them from making complaint. You're not going to request them not to make complaint. You say, yes, absolutely, we are there to help you. Okay, if you
We
require
guide you.
any
We
help,
would.
we can
Yeah. Yeah.
direct you. We can guide you how to make complaint through PALS, and then say patient advisory liaison system.
Patient advisory liaison system. Thank you.
Okay.
Thank you.
Should we go to next station?